The ongoing role I think that I have is to help you find ways of affording health care, despite the fact that the Affordable Health Care Act is supposed to make that something that's reachable for everyone. In fact, I believe that certainly in the immediate future, over the next few years, the cost of health care is going to skyrocket. I want to explain to you why a doctor, like a primary care doctor, might be interested, or even a surgeon, might be interested in negotiating a deal with you based on cash if you have like a large deductible or if you don't have insurance. Let's understand this. You go to a doctor and the doctor sends you a bill, or anybody a bill, an insurance company, for $200. Of that $200, they actually have a negotiated rate. So whatever they charge really doesn't mean much because they had to cut a deal with the insurance company in order to have you come to them, their participating provider. So if $200, maybe they're going to get $100 plus your copayment of, say, $15. So now it's $115. Okay. Now you would say, oh, so that's what the doctor made, but actually not so, because they now, in order to get that, they had to buy software on a computer and send it in electronically, and they had to pay for that software. They have to have staff trained to know how to use that software. So of the $115, actually, the overhead necessary to bill you is about 60%, for example, in a primary care doctor's office. So you take 60% of 115, and they have to wait for that money to come in. And sometimes it could take months for them to get that 30 or 40 bucks. Well, that's where you come in. Because you go to a doctor's office and you say, look, I'm going to pay you cash. And cash may mean with or without a Visa or a MasterCard. The reason is that that money comes to them much faster. It's in their bank in 24 or 48 hours. They didn't have to bill for it. They didn't have to do anything for it except to deliver what they're supposed to do, which is deliver you medical services. That becomes very appealing. If they're not interested, do not freak out. It's time for you to look for another doctor who will accept cash. As the medical economy gets worse and worse, which it's doing right now, more and more providers will be interested in cutting you a deal. Now, the next time I talk to you, I'm going to start looking for hospitals that might cut deals with you as well, a little bit more complicated. This is Dr. Sam Benjamin with medical news you can use.